Hey everyone, welcome back to Yogita's Rehab Point. So today in this video we are going to discuss everything related to diabetes mellitus. So let's start. So before starting the video, I would like to introduce what is diabetes mellitus. Diabetes mellitus is a condition in which there is a lack of hormone insulin in the blood. If you don't know about the insulin, it is a hormone which is secreted by the pancreas, and pancreas is an organ which is located posterior to the stomach. So basically in diabetes mellitus, the level of blood glucose decreased, which is also called as hyperglycemia, which result in the insulin production and secretion, decreased cellular response to the insulin or both. So it's time to discuss about the pathophysiology of diabetes mellitus. So there are three basic reasons of the DM: uncertain chemicals, genetics, and unhealthy lifestyle. Due to unhealthy lifestyle, visceral obesity is there and insulin sensitivity, which ultimately leads to hyperglycemia. Or if there is any genetic history, so there can be hyperglycemia as well. In uncertain chemical, insulin secretion and cell mass function is affected. And due to kidney glucose reabsorption as well, hyperglycemia can be there. So let's start discussing the types of DM. So there are two types of diabetes mellitus, type 1 and type 2. Type 2 is most commonest, which occur mostly 90 to 95% of the patient, in which non-insulin dependent is there. And in type 1 diabetes mellitus, insulin dependent diabetes is there. I will explain this with this help of the diagram. So this is a case of a healthy patient in which the pancreas secrete insulin and they go in the cell with the help of insulin receptor. But in case of type 1 diabetes mellitus, the pancreas fail to produce insulin. So if there is no production of insulin, what will go inside the cell? In type 2 diabetes mellitus, the cell fails to respond the insulin properly. So cell is not able to accept insulin, so it cannot move further. So these are the two types of diabetes mellitus, in which I said before type 2 is the commonest, in which cell fails to respond the insulin properly. There are several risk factors of the diabetes mellitus, such as obesity, hypertension, family history, etc. To the clinical manifestation, clinically you will see polyuria, polydipsia, polyphagia, fatigue, weakness, sudden vision change, numbness in hand and feet, dry skin, slowly healing scars, and recurrent infections. So these are the clinical manifestation in the patient of diabetes mellitus. The patient with the type 1 diabetes mellitus, in the beginning, the patient will feel nausea, vomiting, stomach pain, and increased blood glucose level. Can diagnose diabetes mellitus? So basically, two tests are done for the follow-up of the patient, which is the fasting plasma glucose tolerance test, which is the test which is taken before taking any meal in the morning. And there is another test which we do after taking the meal, after like 2 hours, to check the glucose level. Also, there is a test like HbA1c, urine analysis to check ketone and glycouria. Along with that, the urine for protein, etc. These are the tests which are done for the patient of diabetes mellitus. How we can manage the medical treatment? So we can manage the diabetes mellitus with these two things. If the patient is with type 1 diabetes mellitus, we have to treat it with the insulin. If the patient is with type 2 diabetes mellitus, we can treat it with the oral hypoglycemic agents. I will discuss few agents in further video. So basically, this is the chart for the type 1 diabetes mellitus. In this, you can see the brand names, the onset of the medicine, the peak, the duration, and the role of it in the blood sugar management. So if you want, you can take the screenshot and read this in detail. Coming at the most important type 2 diabetes mellitus, the oral hypoglycemic agents are taken, and also we ask the patient to maintain the diet and do exercise regularly to maintain the glucose level. So now let's check few agents of oral hypogenic agents which are used for diabetes. So these all are the agents which are used. So you can learn all of them to help you in the examination, and also it's a very important question which is asked during the viva. So with the medical management, the nutrition management goes hand in hand. So if the patient is not doing the nutrition management, so to cure the diabetes mellitus is very hard. So basically we ask the patient to eat a small amount of fresh fruits. Along with that, starchy vegetables like a quarter of the plate, and along with that you do a quarter of plate with proteins and a quarter of plate with the non-starchy vegetables and 1% slim milk, a glass. So these all are the nutrients which are essential for the patient with diabetes mellitus. So as we know, excess of anything is hazardous. So to cure diabetes mellitus, exercise is very essential. If the patient is suffering from type 2 diabetes mellitus and they are suffering from obesity as well, so it's very important to lose down some weight. So for that you can do 5 minutes of warm up and 5 minutes of the cool down as well, and check your blood glucose level simultaneously. Coming towards the complication, there are several complications of the diabetes mellitus. So it's good to cure all of them with time before it exceeds. So in the chronic, you will see the patient will suffer from neuropathy, nephropathy and retinopathy, and in acute you will see the patient is hyperglycemic and hyperosmolar state. Talking about the preventions, as I said before, losing some weight is very essential with the type 2 diabetes mellitus if the patient is in the obesity condition. So that was everything related to diabetes mellitus, and also tell me in the comment section how you like this video. Thanks for watching.